Would you rather lose a thumb or keep the big toe? Lose an eye or lose an ear? And that's just the beginning. Today we are playing an impossible game of medical would you rather. Insane, entirely what if scenarios that actually happen in real life and in hospital ERs and ORs around the world. We're going to break down the impossible choices, surgical trade-offs, and the honest medical consequences. Then you decide, would you rather? All right, let's dive right in. Scenario 1. Would you rather lose your thumb or lose your big toe? I'll give you a second or two to think about that crazy hospital hypothetical. But losing a digit is a very real scenario that I come across more often than I prefer in the ER. Reason why? Common scenarios. Lawnmower injuries, car accidents, crush injuries in construction, frostbite, infections, animal bites, slow damage from diabetes, you name it. The ways someone can lose their finger or toe are endless, to be honest. And depending on how it happened, the medical approach may change as well. But going back to the big question at hand, would you rather lose your thumb or lose your big toe? Most doctors would say keep the thumb and sacrifice a toe if you had to choose. That sounds brutal for sure, but the thumb is the single most functionally important digit on the body. If you lose it, you lose opposition, aka the ability to press the thumb against the other fingers. And with that goes most of your fine motor skills like precise pinches, buttoning buttons, key turning, writing with speed and control. Whereas if you lose the big toe, you will no doubt change your gait and push-off capability. Patients usually adapt. Occupational therapists can help you use tools in new ways. Physical therapists can retrain your walking, and shoe engineers can design fancy inserts. In practice, surgeons offer 3 common strategies for a missing thumb. First is polization, where the index finger is rotated and repurposed into a thumb. It sounds like a crazy sci-fi scenario, but it preserves one limb, avoids touching the foot, and gives surprisingly good function. The trade-off is you lose your index finger. The second surgical option is toe to thumb transfer, where part or all of the big toe, or sometimes the second toe, along with vessels, nerves, and tendons, and microsurgically reattached to the hand. The operation is long, many hours, and it requires reconnecting vessels under a microscope so the tissue survives, then waiting months for nerves to regrow at roughly 1 to 3 millimeters per day. Bottom line, if your lifestyle depends on fine hand skills, musicians, surgeons, craftspeople, keep the thumb. If you're an elite runner who depends on explosive push-off, you may opt for keeping the foot whole, but most people adapt to losing a big toe better than losing a thumb. Medical make-believe scenario number 2. Would you rather lose sight in one eye or hearing in one ear? This one trips a lot of people up because both senses are huge, but they affect you in very different, sometimes surprising ways. In the emergency department, I see one eye vision loss, usually following trauma. Think blunt trauma, stabbing, a gunshot to the face, or things like retinal detachment, retinal artery occlusion, optic nerve injuries, severe infections, or complications of surgeries, but can also be congenital or even the result of a stroke or tumor. The cause matters a lot clinically because it determines whether recovery or repair is even a possibility. So what's the day-to-day difference? Losing one eye, called monocular vision, removes true stereoscopic depth perception, and that shows up when you try to catch a ball, thread a needle, or judge the gap when you merge lanes. Your visual field on the affected side narrows a bit, and initially everything feels awkward and flat. The good news is the brain is adaptive. You learn to use motion parallax, how objects move relative to you when you shift your head, size cues, and previously learned hand-eye coordination to estimate distance. With practice and vision rehab, many people recalibrate surprisingly well, but there's always a transition period and some tasks remain harder. Losing hearing in one ear, on the other hand, this removes your ability to localize sound and it makes noisy places exhausting. You'll have trouble telling which direction footsteps or honk came from because the world sounds less anchored. All in all, rehab and adaptation matter a ton for both scenarios. So which is worse? Which would you rather have from a medical standpoint? The answer to this is personal. If you're a builder, driver, or someone who does a lot of fast spatial tasks, losing an eye might feel scarier. If your life centers around conversation-heavy jobs or you spend nights in loud environments, hearing or an ear could be more limited. My practical tip, if you've ever been faced with these acute injuries in real life, head to the hospital and get evaluated fast. Some causes are reversible if treated promptly, and early rehab gives the best chance at comfortable functional adaptation. All right, scenario number 3. Would you rather permanently lose smell or permanently losing taste? Ageusia. Think about it, ponder it, let me know your thoughts in the comments below. Alright, the quick truth. Losing smell usually bites harder than losing taste. That's because most of what we call taste is actually smell. Aroma fills in the details that make a pizza taste like pizza instead of just salty, sweet, and fatty. Anosmia, aka losing your smell, quite literally robs you of flavor and critical safety cues. You can't smell smoke, gas leaks, rotten food, or even your own body odor. That loss of sensory richness hits appetite and pleasure hard. And people with anosmia commonly report meals becoming joyless, they eat less, and rates of depression and social withdrawal rise. So what are the common causes? Post-viral injury, for instance, right? COVID made this painfully more common, but also things like head trauma, chronic sinus disease, polyps, and neurodegenerative disease. True complete loss of taste, on the other hand, is rarer. If this scenario happens, you lose basic tastes like sweet, salty, sour, bitter, savory, meaty, but you still do perceive texture and trigeminal sensations. That means while food is blunted, it's often less socially and safety impacting than smell loss. But it's still true even for this scenario. Practical takeaway: if you had to pick between the two from a quality of life standpoint, most clinicians would say ageusia or loss of taste is the less devastating loss. But being real with you, both aren't great options and both deserve prompt attention and supportive rehab. Remember, if you lose smell suddenly, get evaluated right away or see an ENT promptly, because abrupt anosmia can be a sign of things that need urgent workup: vascular events, severe infection, or other reversible causes. If the loss is gradual, still get checked. Some causes like nasal polyps or obstructive sinus disease are treatable. Scenario 4, would you rather donate a kidney or donate a part of your liver to save a stranger? Alright, heroic hypothetical time. You can save someone's life, but you have to give a piece of your body. Do you hand over a kidney or carve off part of your liver? Both are living donor miracles that transplant teams do every day, but they are very different promises to the recipient and to you. Ponder it, let me know what you think. Okay. Let's start simple. Kidneys are built as a paired system. If you donate one, the remaining kidney usually compensates and provides near normal function for the long term. Kidney donation is the more common living donor operation. The surgery today is usually minimally invasive, hospital stay is short, and many donors are back to light activity in a couple weeks and feeling mostly recovered in a month or so. However, that doesn't mean it's trivial. It's still major abdominal surgery with risks for bleeding, infection, blood clots, injury to neighboring structures, anesthesia risk, and a recovery period that interrupts work and family life. So lifelong follow-up is standard. Now, for the other scenario in this medical would you rather, partial liver donation is a different animal. The liver regenerates, as you may know. That's the amazing part. So you can give a sizable chunk and both donor and recipient can end up with functioning livers, but the operation is more invasive. Living donor hepatectomy can mean a larger incision, longer OR time, longer hospital stay, and a more painful, slower recovery. And early surgical risk is higher than for kidney donation. Bleeding, bile leaks, infections, and rarely more serious complications, including liver failure. So what's the takeaway to this would you rather? If you want a lighter surgical burden and shorter recovery while still saving a life, a kidney donation is generally the easier route. If the match or urgency means the recipient needs a liver graft or the recipient is a small child, then partial liver donation can be the most direct, fastest life-saving option, but it comes with higher immediate risk and longer recovery. In either case, you'd be possibly saving a life, which is amazing. I'm curious, have you ever donated an organ or been the recipient of this life-saving procedure? I'd like to hear about the experience in the comments below. Alright, thanks for writing out these unusual medical hypotheticals with me. I don't want to leave you thinking every one of these outcomes is instant disaster. Thanks to modern medicine, rehab, and adaptive tech, lots of people rebuild meaningful, happy lives after injuries or sensory loss. Prosthetics, microsurgery, gait retraining, hearing aids, along with great therapists turn a crisis into a new normal for many. But make no mistake, it's work, and some folks live with these trade-offs every day. If anything in this video hits close to home, sudden loss of smell, vision, hearing, or a traumatic injury, please get evaluated by a medical provider. And I want to hear your wildest ideas. Toss other medical would you rather scenarios in the comments below, and I'll pick the best ones to cover in future episodes. If you found this video interesting, definitely check out this playlist right here and make sure you binge watch everything. Please make sure you smack that subscribe button, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.